This is Topic A, and joining me on the newsline this morning, Dr. Augusto Elias, a neurointerventional radiologist with clinical radiologist at Memorial Medical Center. Dr. Elias, thanks for the time. We appreciate it this morning.
Well, thanks for having me.
We're talking stroke today. How serious of a problem is stroke?
So stroke is the fourth leading cause of death and number one cause of adult disability in the United States, killing nearly 130,000 people per year. There's a stroke every 40 seconds, and every 4 minutes there is a death related to stroke.
And we hear all the time about the tests you can take. What are some of the warning signs that we need to be? Is it the FAST test? Is that the one I'm thinking about?
Correct. The FAST test is an acronym which stands for, it's a fast evaluation that you can do to assess a patient who's having a stroke. And F stands for face, A stands for arm weakness, S stands for slurred speech, and T is the time to call 911.
So those are the things we should be looking for if we think that somebody might be suffering a stroke. What are some of the other warning signs that we should keep an eye out for?
So some of the most typical warning sign is having what we call the transient ischemic attack, which is a mini stroke. This is a complete reversible stroke with no lasting deficits. And the symptoms are very similar to having a real stroke, which is slurred speech, arm and leg weakness, and facial droop. It's important to know that these mini strokes, 40% of the patients will eventually develop a full-blown stroke if they don't take life risk modifications.
Yeah, I know someone, as a matter of fact, who just suffered one of those. And it seems kind of confusing. You hear somebody say a stroke, but what's the difference in these two strokes?
Well, like I said, the transient ischemic attack is just a temporary lack of oxygen and blood to the brain, but it's completely reversible. It does not have lasting or permanent deficits.
What are some of the risk factors we need to be looking for when it comes to stroke, doctor?
So the medical risk factors include having a previous stroke before, one of the mini strokes, as I said, high cholesterol, high blood pressure, heart disease, having a irregular heartbeat, which is known as atrial fibrillation, which in fact increases the risk of stroke to 100%, carotid artery disease, the lifestyle risk modifications, the ones that we can really control, smoking, being overweight, alcohol abuse. In fact, your listeners can go ahead and take a stroke risk assessment card at www.stroke.org, and they can assess their risk for strokes.
Now, when you're looking, you think somebody might be having a stroke. You use the FAST test. I mean, it's right there in the name. Why is it so important to act fast with a stroke?
So time is brain, and 2 million brain cells die every minute in a stroke.
Wow.
So as well as there's a time parameter in which we can administer the clot-busting medication, and that's called TPA, and we have a time limit of 3 hours. So that's one of the main reasons we need to act fast.
What percentage, or do most people return to normal life after suffering a stroke?
So, there are people who do who have complete recovery. But unfortunately, at least 2/3 of the people who suffer from stroke have a permanent disability.
Where can somebody get some more information if they want to about maybe their own risk factors or somebody in their family that they think has some higher risk factors?
Sure. So they can access www.memorial/strokecenter.org, or like I said previously, they can go to stroke.org. Which is part of the American Stroke Association.
All right. Dr. Augusto Elias from Clinical Radiologists at Memorial Medical Center. Thanks for your time, sir. We appreciate it.
Well, thanks so much.